Period pain is common and a normal part of your menstrual cycle. Most women get it at some point in their lives. It's usually felt as painful muscle cramps in the tummy, which can spread to the back and thighs. The pain sometimes comes in intense spasms, while at other times it may be dull but more constant. It may also vary with each period. Some periods may cause little or no discomfort, while others may be more painful. Sometimes you may get pelvic pain even when you do not have your period. Period pain happens when the muscular wall of the uterus tightens. Mild contractions continually occur in your uterus, but they're usually so mild that most women cannot feel them. During the menstrual period, the wall of the uterus starts to contract more vigorously to help the uterine lining shed as part of the menstrual period. When the wall of the uterus contracts, it compresses the blood vessels in the uterus. This temporarily cuts off the blood supply and oxygen supply to your uterus. Without oxygen, the tissues in uterus release chemicals that trigger pain. While your body is releasing these pain-triggering chemicals, it's also producing other chemicals called prostaglandins. These encourage the uterine muscles to contract more, further increasing the level of pain. It's not known why some women have more period pain than others. It may be that some women have a buildup of prostaglandins, which means they experience stronger contractions. Less commonly, period pain can be caused by an underlying medical condition. Period pain linked to an underlying medical condition tends to affect older women. Women aged 30 to 45 are most commonly affected. Medical conditions that can cause period pain include endometriosis, where cells that normally line the womb grow in other places, such as in the fallopian tubes and ovaries. These cells can cause intense pain when they shed. Fibroids, non-cancerous tumors that can grow in or around the womb, and can make your periods heavy and painful. Pelvic inflammatory disease, where your womb, fallopian tubes and ovaries become infected with bacteria, causing them to become severely inflamed. Adenomyosis, where the tissue that normally lines the womb starts to grow within the muscular womb wall, making your periods particularly painful. An intrauterine device is a type of contraception made from copper and plastic that fits inside the womb. It can also sometimes cause period pain, particularly during the first few months after it's inserted. You may notice a change in your normal pattern of pain if your period pain is linked to a medical condition or a contraceptive IUD. For example, the pain may be more severe or it may last much longer than normal. You may also have irregular periods, bleeding in between periods, a thicker foul-smelling vaginal discharge, pain during sex. See a GP if you have any of these symptoms as well as period pain. Period pain usually starts when your bleeding begins, although some women have pain several days before the start of their period. The pain usually lasts 48 to 72 hours, although it can last longer. It's usually at its worst when your bleeding is heaviest. Young girls often have period pain when they begin getting periods. Period pain that does not have an underlying cause tends to improve as a woman gets older. Many women also notice an improvement after they've had children. In most cases, period pain is mild enough to treat at home. You can take ibuprofen and aspirin to help manage your pain. However, do not take ibuprofen or aspirin if you have asthma or stomach, kidney or liver problems. Aspirin should not be taken by anyone under 16 years of age. You could also try paracetamol, but studies have shown that it does not reduce pain as well as ibuprofen or aspirin. If ordinary painkillers do not help, your GP may prescribe a stronger painkiller, such as naproxen or Cotin. You could also try stopping smoking. Smoking is thought to increase the risk of period pain. Exercise. You may not feel like exercising during a painful period, but being active may reduce pain. Try some gentle swimming, walking or cycling. Heat. Putting a heat pad or hot water bottle, wrapped in a tea towel on your tummy, may help reduce pain. Warm bath or shower. Taking a warm bath or shower can relieve pain and help you relax. Massage. Light, circular massage around your lower abdomen may also help reduce pain. Relaxation techniques. Relaxing activities, such as yoga or pilates, may help distract you from feelings of pain and discomfort. Transcutaneous electronic nerve stimulation is a small battery-operated device that delivers a mild electrical current to your tummy to help reduce pain. See you in next video. Don't forget to subscribe and hit the bell icon for more videos.